to attract and maintain and retain excellent physicians who actually help the patients not only receive the best medical care, and in particularly for Dr. Singal, to be able to make the best decisions as to what care they want to receive. In today's advancing field of oncology, patients have many options as to surgery, radiation therapy, and pharmacology, immunotherapy. And she's an expert in helping and directing people in making those decisions. So she also has a great interest in prevention. And the fact is that there is no better physician who can prevent you from having a large list of medications and surgical scars. So she has dedicated her attention as to keeping you from the operating room, keeping you from having to see an oncologist and or a cardiologist for that matter. So let her present her wonderful work, and we're looking forward to your questions.
Thank you, Dr. Molina, and I really appreciate you doing this from the airport. I know how dedicated you are to our work, and that shows. So thank you so much.
You're welcome. So I will listen as I go in through TSA.
All right.
What? Sound. Ashish, I think there's a big echo.
Is there echo now? Okay, but you have muted.
Dr. Singal, I see 2 devices with your name. Perhaps that could be the reason for the echo.
All right.
Okay.
Can you hear me now?
Yeah, good.
Yes.
Okay, I got it. All right.
And you can share your screen now.
Okay. All right. Thank you so much, Dr. Molina. I really appreciate the kind words that you said. Dr. Molina and I used to have offices next door to each other. So we have been friends and colleagues for a very long time. And so I do have I do speak very quickly, and if there are questions, happy to take them at the end. One of the things that may not be evident to people is that when we talk about cancer prevention, right, in the last, most people know that if you don't smoke or you don't drink alcohol or you stay out of the sun, that those are pretty reasonable things to prevent cancer. But the fact is that there's so much in your lifestyle that predisposes people to developing cancer. And so when you look at cancer incidence in 2023, about 1 in 3 people will develop cancer in their lifetime. And that number is only going up. So we as surgeons, we as medical oncologists, we do our best to treat cancer. But if we could convince people to do prevention and to think about cancer as a preventable disease, we would be so much more successful. And the number that I want you to remember is that 40% of cancer is preventable. So when you look at my slides and when you look at all of these things, think that cancer can be preventable. Some of it obviously isn't, but there's a lot of things people can do to improve the risk. All right. So when we look at cancer incident, 77% an increase in cancer cases worldwide by 2050. Top cancers: lung, breast, colon, prostate, stomach. And the good news about all of that, even though there's more cancer that is being found, is that we have many, many more survivors than we used to. So over 70% of cancer patients will survive more than 5 years, and about 50% will survive more than 10 years, which is to say that we will have a growing number of people who are cancer survivors. And so all of the things that I'm going to talk about cancer prevention, it matters for people undergoing treatment, and it matters for people who are survivors as well. And I didn't mention this at the beginning, but I'm so grateful for the partnership with the South Asian Heart Center on our cancer survivors, because I think it's so important as we go forward with our cancer survivors, right? We want you to get back to your regularly scheduled life. We want you to take with you a few little habits that will keep recurrence and keep you healthy. And so this is a complicated slide, but what I will tell you is that every year or every couple of years, there's an article that comes out in a very prestigious magazine called Cell, and they talk about the hallmarks of cancer. What are these hallmarks? So in 2010, I think 2011 is the picture on the left. We had some ideas about what promotes cancer, what gets us from a normal cell to a cancerous cell. And in 2026, this is the picture on the right. So it has become a very complicated thing about how we develop cancer. There are things that are primary to the cell. There are things that are primary to the microenvironment. There are things that involve your immune system that allow you to develop cancer. And we're slowly but surely trying to understand what that means, and where our choices in our lifestyle and choices in how we eat, how we sleep, how we exercise affect all of those places. So this is a slide that I talk with my breast cancer patients about, but I'm going to talk with you about it in a way so that you understand a little bit about progression of disease. And so when you start, if you were to look at cancer under the microscope, it's a progression. You start with a normal cell, you accumulate mutations, you accumulate dysfunction, and eventually it becomes cancer. And so I want to go through a little bit of what that means. And if you look in the microscope at a normal cell, what it looks like under a microscope is it looks very similar to an aerial view of a country club. So what you might see is one lot. That lot has one house on it and a lot of green grass. The house next door looks exactly the same. And what you have is you have a court, and the court is called the lobule, and the street is called the duct. And if you look at poorly differentiated cancer under the microscope, it looks like a bad neighborhood. It looks like one where you can't see the house from the street, you can't distinguish features, you can't distinguish things. And so how do you go from this very pristine, organized structure to something that is very disorganized? And so what happens is you accumulate mutations, you make these changes. And there are things that are precancerous, there are things that precancerous, and that is really the area in which lifestyle affects it. All right. So when you convert your country club lot into what looks like a flagship lot, you change the ratio of the nucleus to the cytoplasm, or in my analogy, the house to the grass. That becomes a high risk precancerous lesion, and that will eventually develop into cancer within 15 years. Maybe 50% of those will develop into cancer. Then as you accumulate more mutations, it looks like under the microscope as if you have condos or townhouses. And then those townhouses are crowded. So you have more stuff where there used to be just a house and a lot. And as you start to accumulate more mutations, it looks more irregular. Like a truck is parked on the lawn, the garbage is all over the place, and it's starting to become irregular. And so when you have filled up your entire lot with garbage, all of that is still pre-cancer. The minute that you can take your garbage or your trash that fills up the cell and you can move it somewhere else, that's actually cancer. And it's that ability to travel, that ability to move somewhere else and lodge somewhere is actually cancer. And so the reason that I say this to you is that all of the things that we're going to talk about today and a little bit later is really trying to change. So if there's any irregular cells, for removing those irregular cells, for preventing any transition of a normal looking cell into an irregular cell. And what we didn't really understand before is that there are a lot of lifestyle features that affect that transition. And so when we talk about the development of malignancy, we're really talking about the effect on the cell that these lifestyle things do to prevent cancer from continuing. So when we again, this is from this Cell article, and what you can see on this slide is that there are things that drive cells to be different, okay, and for them to accumulate these mutations. And some of them we know about. Some of them are things like we get older. Sometimes we don't divide cells and replicate them so that they have a fidelity of, and so we make mistakes when we replicate. We have environmental toxins that some of them we know about, some of them we don't know about. The big ones that you've heard about for all these years are smoking, UV light. The one you haven't heard about as much is obesity and diet and inflammation. So it turns out that on the obesity side, 12 of the different cancers are directly attributable to obesity and diet. So that's a new piece of information that's come out in the last number of years. And then there's the idea of chronic inflammation. So chronic inflammation is another place where cancer cells can grow, cancer cells can become more irregular and things like that. So when we look at what are reversible risks, right? You cannot smoke, you cannot go out in the sun, you can potentially change your diet, change your exercise pattern, and this is where it affects it. So we have some of these things that affect the cells, like your stress, like your sleep deprivation, like your immune suppression, and all of those contribute to the development of malignancy. All right, so this slide is quite busy, but it's a very effective slide, and I'll only point out a couple of things. We talk about lifestyle factors, and the South Asian Heart Center has talked a lot about lifestyle factors. Now, in this, the one I want to point out is everybody around can tell you that lung cancer is caused by smoking, all right? But it's also because of inactivity. It's also because of obesity. And you can reduce your risk of lung cancer, by stopping smoking, but also by improving activity, which who knew that, right? That hasn't been part of the discussion. All right. So, but this slide sort of reflects of all the different kinds of cancers, many of the strongest lifestyle factors that contribute to the development of those cancers. Now, we talk about the power of prevention. Now, this data is from large studies of patients. Hundreds of thousands of patients have been followed for years and years and years, looking at what is preventable. And so if you look at it and you think 40% of cancer is preventable, that's a lot. So if we actually could consider doing any of the things that I'm going to recommend, there's big benefit here. And if you think about the medication that you get, there's no side effect from doing exercise. There's no side effects from eating better. So these are things that have as much importance as medicine, but yet no side effects, and they're totally doable. All right, so this slide is very, very busy, but this comes from the American Institute of Cancer Research, and this is their summary. It's a summary slide. Again, very difficult to read, but essentially on the left-hand panel, they have all the different kinds of cancers. On the upper panel, it talks about all the lifestyle things. And there's clear data of how this is. So all of the red bars that are in here are places in which there's increased risk to that kind of cancer for doing that particular thing. So alcohol, cigarettes, obesity, any of those things are all listed here in this slide. And this is sort of a bigger view of it. But what you really can see is that there's accumulating a tremendous amount of data that certain things are really not good for you on the cancer side. And I will point out here something more concrete here. So when we look at cancer of the colon and rectum, there is a tremendous amount of evidence to suggest that if you drink alcohol, your risk is higher. If you eat red meat or processed meat, and particularly processed meat, has a lot to do with your risk of colon cancer. And so those are things that we didn't really talk about. We didn't really come out and say, listen, these things are just not good for you. And so let's really talk about prevention. So there's such a thing called the living index. And now you can index a lot of different things, but this is the healthy lifestyle and the likelihood of living to be 100. And so there are scores here that you can do. And if you have a score in this list here of 7 to 10, it's favorable that you might live to be 100. Then there's intermediate and unfavorable. But at the end of it, they're all very, very similar. There's a diet component, there's an alcohol component, there's an exercise, and there's smoking, and there's an obesity. So the recommendations that I'm going to talk about come from the American Institute of Cancer Research. And these are all these 10 recommendations that I'm going to review pretty carefully. They studied 40,000 people for 15 years. And the unfortunate thing about it is 90% of people that they studied didn't meet the requirements for meat, processed food, or alcohol consumption. About 50% met the exercise and healthy weight. And if you look at what the adherence is, there's not, maybe 8 or 10% of people adhere to all of the 10 recommendations, and they're associated with a 33% decrease in colon cancer risk. Now, 33%, that's substantial reduction of risk. And yet we don't really talk too much about it. So we're starting to discuss it a little bit more, but here's some of it. So there's a blueprint. So it's really straightforward. All right. These are the 10 items that a person needs to do. And you will see that there's, in all this data from these thousands of people, a 50% decrease in your risk of cancer across the board. You will, if you're doing these things while you're under treatment, you have a 30% improvement in your side effect profile, and you have a 20% improvement in your response to treatment. So all of this is quite important. So what's it mean to be a healthy weight? Okay, so that's one. It's avoid, now these are very difficult. All right, so weight within a healthy range. So the recommendation is that you are a BMI of 25. Now, you can argue all day about whether BMI is a good measure or a bad measure. It's a measure. One can look at weight, circumference, or any of these other measures, but at the end of it, it's healthy eating, physical activity, and exercise. And what the research says is that having overweight and obesity increases your risk for 12 cancers. All right, 12. That is quite a lot. Considering the obesity epidemic that we have, it's critical that we think about these 12 cancers and that these are avoidable risk. So what do? You focus on plant foods that are high in fiber, 30 grams a day, limit the intake of highly processed food, limit the sugary beverages and alcohol, be physically active, exercise, make activity part of your day. So the physically active thing, it turns out to be, out of all these recommendations that I'm going to tell you, being physically active is probably the most important. It provides the best return on your time spent doing it. Okay. So the recommendation is this: 150 minutes of moderate intensity exercise or 75 minutes of vigorous activity weekly. And what they talk about is that if you can do enough exercise that you're slightly out of breath, so you can talk but you can't sing, twice a week strength training, twice a week flexibility training. And we have stuff that's free. We have Silver Sneakers. We have cancer exercise programs in the Cancer Center. We have all of these things people can do. I am a fan of a couple of different things. I think it's very difficult for people who are busy to incorporate this "I'm going to go to the gym" thing, because some people, if you're really not committed to it, you're going to pay for a gym membership for 12 months and you're going to go twice. And it's because the logistics of it just don't work. So there's such a concept called exercise snacks. And so the exercise day, you might choose to run up the stairs. You might choose to walk around the block. You might choose to park far from Costco and walk once around Costco before you go do your shopping. And that introduces 5, 10, 15 minutes of movement within your day. And so you're not partitioning time aside. You're actually just incorporating it as part of your day. And you can add up to this 150 minutes if you do things like that. Now, the research says it can protect you directly, right? Breast cancer, colon cancer, endometrial cancer. These are all that ones that survival is really impacted by exercise. Now, the reason I'm going to tell you this is another article that has come out recently about, you might ask the question, all right, how does exercise actually change my cancer risk? How does it prevent metastasis from happening? How does it do any of that? So if you think that, so the thing that's becoming clear is that when you have obesity, you set up an inflammatory pathway, and you have this low-grade inflammation and a metabolic disturbance. All right, that provides an environment in which cancer cells grow and that your immunity is lower. So acute exercise can have endocrine effects. It can improve your immune system. It can improve the functioning of your immune system. But persistent exercise changes your immune function, changes your metabolic health, improves the perfusion, and you get more of your body monitoring itself rather than having these things grow in different places in your body. So exercise has a real connection to what happens to your immune system, what happens to the inflammation, what happens to the obesity. And this thing is persistent. So if you look at cancer prevention, there's fewer tumors. You can look at exercise during anti-cancer treatment. And again, it enhances the patient's side effect profile. It promotes efficacy of treatment. It decreases some of the really severe side effects of anti-cancer treatment. As you have finished cancer treatment, it prevents relapse. Some of the long-term side effects of chemotherapy are better. And again, if you have a relapse, it goes back, and that this exercise turns out to help you substantially. Now, there was a trial done, and I'm sorry for the slide's a little blurry. There was a trial done last year that hit the headlines. It was so impressive. It was part of the ASCO plenary session. What they did is they took colon cancer patients that had node-positive disease, which means they are at 20 to 40% chance of recurrent disease. And they put half of them into doing exercise however they felt like it. And then they put the other half of people into behavior-supported exercise, held them accountable, supervised exercise sessions. And what they were able to show, and this is the first time they were able to show it, is that there was actually a substantial decrease in the recurrence rate by 39%, and there was an improvement in overall survival by 23%. So it actually connected the exercise that you did to the outcome. And that is a huge step forward for us. And when you think about what the oncologist says to the patient, listen, if I give you this drug, we have a 30 to 40% chance of improving. Well, here you have exercise with a 30 to 40% chance of improving without any side effects whatsoever. So again, something to really think about. So this is part of my my discussion about exercise snacks. And nobody said that you had to go to the gym for 2 hours a day. It's not that. It's really just incorporating this movement into the way that you live. Now, let's continue on to diet, because many of us are convinced that food is medicine. So when you think about food as medicine, the general recommendation is a diet rich in fruit and whole grains, vegetables, fruit, and beans. But it's really difficult to do some of these things. And so what I talk to my patients about, and it's clear that a diet rich in plant and plant-based food is significantly better for you than a heavy meat diet. All right. It doesn't mean you can't eat meat, but it does mean that you should incorporate some of these other things in there. So a diet of 30 grams of fiber from food. Now, you can get that fiber from a handful of bran flakes. You can get that fiber from gummy bears that contain fiber. There's a lot of different ways to get this. It's better to get it from plants and from natural food. All right. Now, if you look at the recommendations, there are 4 tiers of recommendations. So the first one is what we call, and we started this here at El Camino, called the Cancer Healthy Meal. So when you look at your plate, what you should see is a quarter starch, quarter protein, half fruits and vegetables. And those fruits and vegetables should be colors of the rainbow. And that colors of the rainbow, the stuff that's hard are purples, right? So beets, carrots, cabbage, are not on everybody's dietary list. So you do have to be mixing them up with some berries or other things that are those colors. All right. The next step up from this eating colors of the rainbow is eating 9 servings of fruits and vegetables the size of your palm. Again, it's a lot of food. So what the nutritionists tend to recommend is that you eat 1 serving breakfast, lunch, and dinner, 2 snacks, and juice or soup or anything else for the rest of the 4 servings. Now, if you're really super ambitious, and you might have to get the food chart out, because if you can eat 30 different fruits and vegetables in a week, now the key item here is different. So this week you eat 30, the next week you eat 30, the week after that you eat a different 30. That is a project. It is really difficult to do that. And if you can take sort of a simple lesson from what I'm talking about, what you could strive for, and not to make everybody feel bad, like, oh, I don't do this, is really that this is aspirational, right? If you can eat more colors of vegetables and fruit, if you could eat slightly more of them, and if you could eat different ones, you're on the right track. So here we are with some fiber opportunities, lentils being a big one, black beans, right? This is the 10-inch plate that I was telling you about. Variety, okay, 3.5 cups, and more grains. And you try to swap out anything that's white. So if you are a fan of white bread, white rice, and white potatoes, look at those as negotiable. Now, the research says that the dietary fiber protects you against colon cancer, the whole grain consumption against colon cancer. And again, it's with starting small. So small improvements over time become big improvements. And so, you're not going to get there all at one time. And I spent 4 months trying to get to 30 different fruits and vegetables in a day, and I really couldn't do it. Because this is the vegetable chart. And if you look at it, there's an enormous variety of vegetables that one could choose from. And the idea is to mix it up, and there's a lot of choice. So I'm going to talk a little bit about processed foods, all right? Because really, we think a lot of the cancers, particularly the GI tract, are a result of our increased consumption of processed food. So when you look at what's minimally processed, right? An apple, potato, corn, carrots, that are pretty straightforward, healthy things to eat. Processed. Now, some of the stuff that's processed, you'd be really surprised. So applesauce, canned corn, carrot juice, they might all be processed. And then there's a category of ultra processed. So things like Cheetos, Doritos, French fries from fast food, all have an element of ultra processed, which is really the problem. So fast foods and other processed foods. So when we talk about fast foods, TV dinners, frozen items, chocolate chip cookies and such. So we know that those are not good for us, and they know that they contribute because they're large portions and fried and all of those things. But yet, they seem to have figured out that we want to know how many calories are in things, right? So here's on the panel on the left, I pulled from Taco Bell all the different nutritional things that Taco Bell lists. And so you can see that they're fairly high calorie items with a lot of processed materials in there. So if you cut down on processed foods and drinks that are high fat, it means you're less likely to gain weight. And being of a healthy weight improves your risk of 12 cancers. And looking at these lists of ultra-processed food, trying to figure out, I mean, some of them we know are ultra-processed food, like Cheetos. But some of them you may not realize. So there's a website called Nova, and Nova rates, and they rate it moderately well, that they have ultra-processed foods. And so the unprocessed, minimally processed foods are really on this slide, right? And they tend to be simpler foods that we know. The group 2 are processed culinary ingredients, things that, oils, butters, sugars, salts, things like that. Then you have the group of processed foods. Now, some of this processed food, you wouldn't necessarily think about it like a piece of cheese, but it can be in the processed food category. Now, group 4 is the ultra processed food, which we would all agree to, right? This is the slide that you would try to stay away from if you were trying to eat better, okay? It doesn't mean that once in a while on your birthday you can't have a piece of cake. It just means that as a regular 3-5 servings a day, try not to do this. This was the one that hurt my feelings tremendously because I'm a great fan of Chobani, and I thought that I was doing a good job of being healthy, eating Greek yogurt with slightly flavored yogurt. But it turns out that has as much sugar as a Snickers bar. So really, you should be in the group 2, which is plain yogurt, and add your fresh fruit to it. And there's a lot of examples like this, but this is one where it was a little bit sneaky because you really sort of felt that Chobani was not a bad choice. All right, red meat and processed meat. So if you eat red meat, limit the consumption to 12 to 18 ounces a week. And if you can, to do what I call as meat flavored, right? So you are not eating a lot more than 18 ounces, but it's not to say that you have to go fully plant-based. But if you can go plant-based, that would be better for you. So red meat, 3 portions a week of these things. Now, processed meat. Now, if you're going to eat red meat, no problem. That's what you can do. But if you can stay away from the processed stuff, that would be probably the best thing that you could do, because this is really high impact. The nitrates, all of the stuff that's in processed meat, the multi-ingredient stuff, is really bad for your GI tract. And so the research says very, very clearly that this is increasing your risk of colorectal cancer. And it's been all over the news about younger people having colorectal cancer. And I don't know whether they point the finger to processed food, but it's one of the fingers to be pointed at. There's another website which you can look at, which is called EWG. And EWG has ingredient concerns. It's very, very thorough. And what it would say is it gives you nutrition concern, ingredient concern, processing concern. And so if you have a question, you're interested, you're eating a lot of, I don't know what, you could probably look on this site and see, because it's by brand name. And so you can see what these things score. Now, again, it's a scoring system. Not everything's on here, and there's a lot of controversy about who makes these decisions about these scores. But at the end of it, it's another source of information. So rethink your plate. What can you do? What can you swap out? What can you do differently? And that's something, if you're interested in something that might happen to you in the year's future, then this is a good one to think through. Now, we talk a lot about sugar-sweetened drinks. Now, sugar-sweetened drinks add to calories. They add to weight. They are difficult to manage. So if you think about a can of soda can have 16 teaspoons of sugar. All right, that is a lot of time on the treadmill to try to get rid of that 16 teaspoons of sugar. So there's some choices. You can drink water-infused things. You can just drink water. You can choose to drink other things than sugar-sweetened drinks. And the research says, again, it contributes to this weight gain, overweight, obesity, which is related to these 12 cancers. And again, these are choices that you can make. Now, alcohol consumption. So alcohol consumption is a controversial topic, because the numbers, this year they say no more than 1 drink. Next year they say don't drink any. The year after that, it's 2 drinks. So it's been a little bit all over the place. But at the end of it, no more in women. It's sort of settled on no more than 1 drink a day for women. But if you think about that, 1 drink a day is 7 drinks a week. And for men, it would be 14 drinks a week. That's a lot of alcohol to be consuming in a week. And the recommendation is not to drink any alcohol. And the research says it's at risk for 6 different kinds of cancer. So pharyngeal cancer, esophagus, liver, breast, stomach, and colorectal cancer. And just by reducing that or limiting that, you can protect yourself against those cancers. Now, there are a lot of people, and particularly patients, that have a lot of questions about supplements. We, as a group, don't necessarily endorse supplements for cancer prevention. All right. Now, it's not been shown that any of these supplements are making a big difference. And mind you, there's thousands and millions of supplements. What the AICR and what the World Health Organization talk about is really nutrients that come from food that you ingest. The supplement part is not easily worked out because there's a lot of variability with it, but the recommendation is not to use that. And the American plate, the healthier choices, the swapping. For mothers who are here, breastfeed your baby if you can. Again, that's a World Health Organization recommendation. It's good for the mother, it's good for the baby. They think that it's protective against breast cancer, and breastfed is protecting children against excess weight gain and that. So the last recommendation is to follow these same recommendations that you did on cancer prevention during any kind of cancer diagnosis, any kind of cancer treatment, and as a cancer survivor. So we think that we have settled on at least 10 decent recommendations that lead to substantial decrease in your recurrence rate, your quality of life, your medication. And so we hope that with the help of the health coaches, with the help of a little bit more visibility to these recommendations and things like that, that people will start to adopt it, and then maybe we'll level off on our cancer incidence. So I thank you very much for your time, and I will stop sharing and be available for questions if anybody has any questions.
Oh, wow. Thank you, Dr. Singhal. This was such an informative and inspiring presentation. We have so many questions in the chat already. It's wonderful to see so much of engagement from our audience, and these are certainly thought-provoking questions. So we'll do our best to address as many as possible in the time that we have. Um, uh, you already kind of mentioned about meat and processed meat. And one of the comment was one of the main reasons that Americans have a high prevalence of cancer involves high consumption of beef and other meats derived from cows and animals fed with hormones such as growth hormones. And it's in line with the way food industry works to make supply enough to meet the needs. So any final thoughts on that with meat consumption?
Well, so the recommendation is between 12 and 18 ounces, which is about 3 servings. And, it's a cultural thing. This is how people eat. This is what they do. So I'm not judgy about this. All I would recommend to you is that if you can go to fewer servings and swap it out for something else, you will be able to then wean yourself off of it. You can still have whatever you want for your birthday, for a celebration or whatever, but just remember that processed meat is not serving you well.
So leaning more towards plant-based foods overall.
Yeah, or what I joke around about is meat flavored. Like you don't have to make it hard on yourself. You just have to dial it down.
And everything in moderation, as we talk at the center, is more sustainable in terms of lifelong habits, right? Are there other reasons why cancer rates are going up dramatically? Meaning, is it a question of increased detection or increased frequency?
A little bit of both. I think that we do as a developed country, we do do a lot more detection, but worldwide, the smoking related cancers. Now, mind you, there are also 12 smoking related cancers. So people don't realize, like, you assume that it's lung, but lung, bladder, pancreas, right? Those are all smoking related cancers. So in the non-developed world, smoking is probably the biggest contributor.
Okay. All right. And how about high frequency electromagnetic radiation, such as widespread use of cell phones, Wi-Fi? We hear this concern about mostly the youngsters wearing AirPods all the time, and even microwave ovens. How
So I don't know that we've been able to prove it, right? That's a tough one to prove. I think that the AirPod thing is more on their ears, like they can't hear anymore. But I don't know any of the data on electromagnetic stuff. I think that when you look at impact in general, right? So if you had one thing that you could do that could really change your risk, it would be on exercise and diet. And then microwave and microdosing, whatever thing, is probably way lower on the impact list. It doesn't mean it's zero, but it's less impact.
All right. And those are also more modifiable factors with diet and exercise than the non-modifiable. Right. And so we do have a lot of questions on diet. What's any thoughts on what could be the impact of coffee on the liver or coffee in general, whether it has any association with?
So I don't know. I don't
Mm.
know the direct correlation of coffee.
Mm.
The
Mm.
recommendations are really broad.
Mm.
So each individual item, there are a few websites like EWG has some impact things on whether it contributes to malignancy. There's also
Mm.
some information on the Memorial Sloan Kettering website about risks of different foods, different things.
Okay. All right. Um, Speaking about beverages and our simple water, would you be able to suggest any good drinking water treatment to remove contaminants?
I don't know. I don't know that one. Yeah.
Okay.
We
Yeah.
you know, when they talk about water and how much, so the contaminant portion is twofold, right? It's in the water itself to clear it of contaminants. That's one thing. But how much water do you have to drink to keep yourself hydrated? And the
Mm.
recommendation is 8 glasses of water, right?
Mm-hmm.
That's the recommendation.
Yeah. Yeah. Okay. Thank you. Right. And any specific information on multiple myeloma type of cancer? Any specific risk factors?
Well, so the risk factors for myeloma are different than what I'm talking about today, right?
Mm.
So when they looked at response to treatment for myeloma, these AICR recommendations led to, I think it was 37% decrease in recurrence rates and in response to medication. There's several papers on this because when they originally did these studies on exercise and stuff like that, it wasn't specific to cancers, right? And all of these specific cancer ones have come out subsequently. So prostate cancer, multiple myeloma, colorectal. And so everyone has taken these AICR recommendations and applied them to the different cancers. And so it's consistent across the board with varying numbers that it impacts your recurrence rate, it impacts your overall survival, and impacts your response to medication.
Thank you. We spoke about how things can influence at the molecular level and how obesity could cause inflammation. So one of the questions was, would intermittent fasting be of help, especially with cleaning cellular waste?
It's possible, but I don't know much about that. I think you'd have to probably get to somebody like Dr. Molina who could contribute to that question.
Okay.
What the way that it was explained to me and the way I understood it from the articles is that obesity gives you this low level inflammation. And when you have this low level inflammation, your body's in a different state. And so that different state then affects your immune system. It affects your ability to fight off abnormalities in cells and things like that. And so that's where obesity really contributes. And so any decrease in inflammatory things related to obesity will change that risk at that.
Okay. All right. Everyone was really interested in the AICR recommendations, and they wanted to know if those were specific. Let me try to see if I can unmute. So I can hear some. Okay. If the AICR recommendations were specifically for beating odds of getting cancer, or were they for survivors?
It's for everyone.
everyone.
So
For everyone.
there's a whole
Yeah.
section on prevention.
Mm.
And then recommendation number 10 is that you do that during treatment and post-treatment.
Okay. All right, great. And then it was wonderful to read about the benefits of exercise, and the 30 fruits and vegetables is certainly a number that will stick with us, including the rainbow on our plate with the plate method. I have some nice ways in which people are going to adopt that. Somebody's mentioned that they could have a printed list put up on the refrigerator as a gentle hint reminder, and then Costco groceries are now going to be done, walking to and back to Costco. Um, uh, there were some questions about dairy specifically. Dairy is always kind of controversial in that sense. So, what would be the effect of dairy on cancer? And any thoughts on like cottage cheese in particular in that UPF list where it might
So
come up?
cottage cheese is a complicated one, right? Because if you don't have another source of protein, tofu, beans, lentils, all that stuff, cottage cheese is a really good source of protein. So,
Mhm.
in your swapping things, like you're swapping from an ultra processed bacon to maybe cottage cheese. So that's an okay swap, right?
Mhm.
And
Mhm.
the thing is that once you get down from all these high risk things, then you can optimize within dairy, not dairy,
Yeah,
etc. I think it's very difficult for people to be fully off of dairy.
correct. Yeah, and there's some research that I had heard that fermented dairy is probably like one of the safest bets. It has the lowest risk with overall with cancer. So even amongst dairy, fermented dairy choices might be better
So if you had an
choice.
impact, and so this is where I sort of diverge from the general thing, is that there are things that you can do which really will change your life, right? Don't
Hmm.
smoke, right? That's a
Hmm.
big one, right?
Hmm.
Um, Stay away from these processed meats, stay away
Hmm.
from these heavy sugar drinks, right?
Hmm.
Those are
Hmm.
huge impact changes.
Hmm.
Whether you buy cottage cheese organic or cottage cheese non-organic is
Hmm.
sort of a micro drop in that ocean
Hmm. Hmm.
of
Yeah.
choices. And I have no argument with anybody that wants to manage it that
Hmm.
tightly.
Hmm.
But the thing is that the really big impact stuff
Hmm. Hmm.
should be covered first before you
Correct.
do the micro
Yeah.
dosing.
Got it. Okay. All right. There was a question on GLP medications. Do GLP medications like metformin or Ozempic fight cancer, not just indirectly through weight loss, but directly through known molecular pathways as well?
So there's a lot of discussion about that. I don't know that anybody's shown definitively that there's a direct correlation. I think that people have evidence to suggest that the indirect way, that by losing that weight, your risk.
Mm.
But remember, these risk reduction studies are long, right? You have to follow people for tens of 15s of years. So I don't know that the data is ready for prime time, but I think there's some suggestion that losing that weight will help you.
Okay. All right. Sugar, part of it was already discussed with, overall sugar consumption and sugar sweetened beverages in particular. There was a question, would you consider sugar as the number one cause of cancer?
Sugar contributes to the problem.
Mm.
I still am believe that it's smoking that contributes the most
Okay.
out of everything. So smoking, pollution, all that, internal
Okay.
pollution, external pollution, I think is probably higher on the list than sugar.
Okay.
And again, sugar in moderation, right? Not drinking 5 sodas a day, right?
Mm.
If you have a teaspoon of sugar in your tea and you have 1 tea a
Mm.
day, that's
Mm.
not the thing that's going to kill you, right?
Mm.
It's the other stuff.
Mm. Any research on a fish, if fish might be a better choice than red meat? Um, Even within the fish, there's kind of so many considerations, right, with mercury level and whether it needs to be preferably wild caught. And of course, we want to choose the ones that are more high in omega-3 fatty acids. So any thoughts
So
on
I
fish?
think if you look at the big impact thing, the red meat to fish is probably the big impact.
Hmm.
Which fish is an
Hmm.
optimization,
Hmm. So big impact and optimization. Okay. All
right?
right. Okay, I'm
Right,
writing it down.
because,
Yeah.
if you look at the number of people that follow these recommendations, right,
Mm-hmm.
it's 8%. So
Mm-hmm.
there's only 8% of people that follow these recommendations, that even follow 2 or 3 of these recommendations, forget all 10. Um,
Mm-hmm.
so the opportunity to impact is there. If you're going to choose a thing to do, like if you're going to walk away from this lecture with the one thing that I think you ought to do, I would probably tell you it's don't smoke. And after don't smoke, it's do the exercise.
Mm-hmm. Yeah. Okay. All right. So smoking, avoiding smoking and more exercise. Um, food continues to be of most interest to everyone. And there are some questions on ghee and jaggery as well. Ghee has saturated fat, and whether it's similar in nature to the type of saturated fat that's present in meat, or would pure ghee be a good choice for cooking fat?
So I had this long discussion with Dr. Molina about ghee. And so I think he's your best effort on ghee.
Okay.
He has the most information of anyone I know about ghee.
Okay. All right. If at all, Dr. Molina, we can check back with him if he is available to share some comments, then we can request him to do so. Now this was again with lung cancer, and in increasing incidents that we see amongst non-smoking Asian women. Does standing and cooking in front of a gas stove for about 1 to 2 hours a day increase the risk for lung cancer?
So I think that falls in that category of secondhand smoke and secondhand pollution and stuff like that. And so I think the data is limited on that.
Okay. Somebody is probably listening to you from another device as well. I can hear some echo. Could I request everyone to mute themselves, please? Okay. All right. There was some comments on how some of the ultra processed foods are a part of diet among children, and whether they are able to get away with it because they are more active. It also, it may be important to have these good habits start young. It's very difficult when the taste palates develop in a manner which get satisfied with more sugar and salt, and that kind of continues in adulthood as well.
So for children, it's really there's lots of really good data about screen time. It's really a lot of data about sedentary lifestyle, right? And so what people have suggested, and I'm not an expert in this particular thing at all, is how children get their habits, right? So if a household is all going out after dinner and walking and not being on their iPad or their phone or their whatever thing it is, then that's a household that probably can incorporate other of these habits. And so children are going to learn from models, right? So if you're having your after dinner Cheetos, then maybe that's what they're going to see.
Yeah. So for parents, it's like something I heard today afternoon, walking the walk and talking the talk. So it's right. Fruit sprayed with insecticides or pesticides in general, would that be considered a risk factor? Any recommendations on how we can minimize, how we can wash things at home?
They have a couple of different ways that they go about the insecticide thing. One of it is organic fruit. The other one is to eat fruit that's already peeled, that you can peel, or like melons or apples, or but you eat the fruit peeled. And it's a catch-22, because if you eat it peeled, then the nutrients are in the peel, and then you have this sort of la that goes on. But again, to me, this is the micro organizing, because I'd love for you to eat the apple.
Yeah, right. I'm trying to find. There's a comment on hot liquids being consumed, if that poses the risk of cancer. I'm not. Yeah.
There is many studies, in fact, with regard to esophageal cancer. And what esophageal cancer, and particularly in hot tea drinking areas of Iran, like that's where that thing was discovered, is because Iran has one of the most extensive esophageal cancer. They have a lot of it, and they attributed it to, in the epidemiology, to their habit of drinking incredibly hot tea. And so what happens is you get burns in the esophagus, inflammation, and then that chronic inflammation that's done from drinking that hot tea is what leads to the higher incidences of esophageal cancer.
That's very good to know. Right. Sleep, how, having less sleep, less than 6 hours, or specifically interrupted sleep, would that affect risk for cancer?
So if you look at the 6 lifestyle pillars, so when you look at lifestyle pillars, sleep is particularly important because it refreshes the body, brings your heart rate down, all of those things. But postmenopausal women also have sleep disturbances, like the hormonal stuff. And so you really have to be, as you get older, mindful of the sleep component and the refresh of your body that happens from continuous sleep. So there are things people can do. There's simple stuff, right? There's sleep hygiene, which is really to put all your devices out. Like, don't be on your device for 2 hours before you sleep. Things like sleep apnea and making sure that you're not snoring or coughing all night so that you can sleep better. Things like yoga nidra, things like meditation, things like tai chi, all of those things are improve your sleep. And that quality of sleep leads to this body refresh.
All right. So the quality of sleep certainly matters, and sometimes the sleep could also be affected due to sleep apnea. So any correlation between sleep apnea and
Sleep
cancer?
apnea is a whole disease unto itself, right? And sleep apnea leads to a lot of metabolic dysfunction. And so if you're someone that isn't sleeping well, that's one of the primary care things to check. And I feel like they do check it. My being a surgeon, I don't tend to treat it, but there's lots of people who do look out for it and treat it.
Okay. All right. Again, some questions on organic foods and fruits, which we have answered. There are, certain organizations such as Function Health, more on the lines of functional medicine or integrative medicine. They have extensive cancer screening panels. So are those good or worth considering?
So I don't know much about those. I think that some things are not quite ready for prime time. And many of these tests that have come out are difficult to. So there's one that does cancer screening for all different kinds, right? I think we have cancer screening tests that people don't go to, like they don't go to their mammogram, they don't go to their colonoscopy, they don't get their prostate checked, they don't get a screening CT of the lung. And those things, again, I'm a surgeon, so I'm really about what's the biggest impact thing that you could do. It doesn't have to be the most complicated. It just has to be the most impact. And then once you've finished all your high impact things, then move to the next level things, and then move to the next level things. So again, the 5 screening tests that we know about, you should do that. And then once you've finished all those 5, then you can worry about the next 5.
Okay. All right. There's a question here. I'm not very sure if I understand it correctly, but what it says is cancer survivors could have beaten cancer, but at the cost of reduced immunity. Any suggestions and recommendations for them and their caregivers?
So again, the cancer survivors is a large category, right? So some people have a lot of residual side effects of cancer treatment. One of which is fatigue, one of which can be lowered immunity, all of these things. Again, the stuff that improves your immunity are really things like exercise, things like again, these dietary things that people do, sleep, right? A lot of patients post-treatment have a lot of sleep disturbances. And so it's those things to work out. And then there's a component of mental stress and stress, right? This fear that people live with, this fear of recurrence. Oh, and they're always kind of looking over their shoulder saying, oh my God, something's going to happen. Something's going to happen. That takes a lot of effort and energy. And so my recommendation is that cancer being such a different disease than some of these other things, like if you have arthritis or things like that, you don't have the same sense of fear that comes along with cancer. And managing your mental health, managing your stress, finding a way to work with that stress and give you some methods or mechanisms by which you can manage the stress when it comes on are critically important for healing, right?
And that's one of the things that we work with our participants on, and meditation is that's one of our main pillars in our program. In fact, like the next question was, patients often leave with a long list of recommendations: exercise, sleep, stress reduction, weight management, etc. So how do you help someone decide what to focus on?
So again, I'm super practical about it. You do what you can do,
Mm.
right? So if today all you can do is not eat French fries, that's it. That's today's project, right? Don't eat the French fries. If tomorrow you feel like you can walk a block, do that, right? I am, so I'll share with you this thing. So a few years ago, Marie Kondo came out with about cleaning your house and keeping everything exactly neat and finding joy and all that stuff. It put so much stress on me, I can't even tell you. Like I really felt like I was never going to make that. And so I don't want to turn people into, look, this is my list of stuff, and look, I failed because I didn't make all these things. These are aspirational items. So if you can incorporate them, you will get benefit. Right? And that's really where we have to start, and not to be in this criticism of, oh, well, I didn't get all 10, so therefore I have failed. Right? It's really trying to make these little adjustments that potentially could give you a big impact.
Yeah, being kind to yourself along the way. So, there are some participants who have expressed what they're going through. One such person has said, as a cancer patient, I'm prioritizing sleep, exercise, and plant-based diet, and trying to take a break from working as I start radiation and medications over the next 5 years. If I can manage financially, it's hard to go through cancer treatment along with being a parent to two school-age children.
Yeah, no, it's difficult. It's really difficult. I would say to you and to all the other people that there's a lot of support out there for you, right? You have to be in a little bit of a space to accept it. And, there is a lot of support, and we're really trying hard to heal the whole person.
Yeah. I know we discussed a little bit about high frequency electromagnetic waves. It's earlier on. Any thoughts on like dental X-rays and scans done as like routine screening, and how much is okay?
Okay, so the mammogram. So this question always comes up with the mammograms. All right, so everybody's crazy that, oh my God, I'm going to get a mammogram, right? It's the lowest amount of radiation that you could possibly get. You get more radiation going in a plane from New York to San Francisco. So the mammogram's not the problem. The MRI is not the problem. The ultrasound's not the problem. It's repeated CT scans. CT scans have a lot of radiation to it. But if you're under treatment and you need the CT scan, you got to get it. So, okay, got to get it.
Okay. All right. Thank you. Wow, we still have a bunch of questions. We are at 6:55, and I'm going to try and take maybe 2 or 3 more. Let's see. Does cancer risk increase with age?
It does, but it's in this complicated division of aging, right? So as your cells get older, you have less surveillance of mistakes that happen. Mistakes then persist, and the immune system doesn't take care of it necessarily, right? So everything that you can do to improve your immune system is probably worth it.
All right. There's a question on seaweed. There is some confusion when it comes to seaweed as promoted by uh, by by Oriental ethnicities. Seaweed obviously is a good source of omegas and supposedly helps with longevity. But in the grocery stores, the seaweed packages comes with a cancer warning. So
I don't know
it's a
anything about
tricky
that, so
one.
I'll have to
It's a
look that up.
tricky one. Yeah.
So that one, I think you probably should look on the Memorial Sloan Kettering website.
Okay. All right. All right. I will try to look it up, and if we get a conclusive answer, we'll send it back. Okay. And would you be able to comment on GERD?
So GERD, in terms of cancer risk, so the thing about GERD, and it has to do with Barrett's esophagus and some of these other things. So if you are someone who has chronic GERD and they do surveillance and they've decided that you have Barrett's esophagus, there's some percentage of those Barrett's esophagus patients who have chronic inflammation that will develop malignancy. So it's worth it to get it treated. Whether I don't remember exactly what the risk reduction is. So if you get the Barrett's removed or you treat the GERD, what's the risk reduction in esophageal cancer? I don't remember that, but one can probably look that up.
Okay. All right. Thank you. Is lack of being thirsty, could that be a medical issue?
Well, so that's a big question, right? Why are you experiencing this thing? Do you have drive? So probably your primary doctor would be a great place to start with that.
Okay. All right. Amongst South Asian men and women, are there any types of cancer that you see specifically, and any signs that they could look out for during their annual physical exams?
So South Asians here in the US or South Asians in India?
I think there was a question on certain characteristics seen in India as well, but perhaps we could answer, what
So
is
I'm going
here.
to answer 3 different ones. Okay, so
Okay.
if you're Indian in India,
Uh-huh.
do your screening tests, right? Nobody does them. Not anybody does their screening mammograms or this, that, and the other thing because they say they're well. So cool. But screening works. Then pollution is a big one. So pollution, cigarettes, all that stuff. So all the smoking related cancers. And then my cousin is always joking around about this, but the South Asian diet is garbage sometimes because we think it's so healthy, but it's actually a lot of carbs on carbs. So the whole carbs on carbs thing leads to weight gain and lack of movement. So again, it's a little bit of things. Those are modifiable risk, right? Which you can do. Now, in certain parts of India, there's a high incidence of gallbladder cancer. There's a high incidence of pancreas cancer. So again, if you sit down at a holiday or whichever, and you look through the family history and you look and see who's got what, then you know what you as a family can work on.
Okay. All right. Thank you so much. Yeah, it's interesting to kind of see the variation across the regions as well. And this kind of this probably this could be the last question. It would fall more in the optimization category, with cleaning liquids like safer detergent, safer hand soaps, etc. Would that kind of be worth considering in our daily lives?
So again, I think that if you're down to that level, it means you've done all the other things first. Okay.
All right. Well, that's I think we've covered most part. There were some that were repetitions. With the chat is being flooded with a lot of gratitude for the session and for you to stay back and answer all the questions.
Sure, my pleasure.
Yeah.
Anytime.
All right. Okay.
Dr. Singhal, thank you. Thank you so very much. I mean, you had simplified. I mean, I know this is a hard topic, and there is not one good answer for this thing. So you've handled that really well. And of course, the questions, are still kind of coming through, and I'm sure there's a lot of unmet need within the community to kind of get good answers around this. There's certainly cancers on the rise, affecting and really devastating families, and so the work that you do on a day in and day out basis is just so much needed, and I think the community needs to thank you for all of that, and for being here today and participating in this wonderful session.
Well, I thank you so much for inviting me and giving us the opportunity to talk about this. And it sounds like lots of people have a ton of questions. And thank you, Ashish, for your partnership and for helping our patients in their coaching. And there's been such good feedback from the patients about the coaching. It's really been a miraculous addition to things. And one of the I'll just leave you with this one thought, is that we treat people, right? But we have to get them to their regularly scheduled life, right? Once their treatment's finished, like, we have to get you back to doing whatever you were doing before. And the health coaching is part of that transition to survivorship, right? It's getting you back, figuring out what's important, and providing you the support to do that. And it's such a big piece of what we do.
Yes, indeed. And yes, you're right. I mean, we have also heard from folks, and the fact that, they have just extended their, work with us and extended the coaching for another session, or another set of sessions, is testament to the fact that it's working and it's useful, for them. Thank you.
Okay. Thank you so much. I appreciate it.
All right, then.
Okay. Bye-bye.
Thank you, Dr. Singhal. Bye-bye.
हम सब सिंगल हो गए अब।
Right. Thank you, everyone.
Thank you. Yeah.